Hello guys and welcome back to our channel CMS Prep. Today in this video we are going to discuss all the questions related to preventive pediatrics and obstetrics asked in UPSC CMS from 2009 till 2024. We have about 38 questions, so let us begin. Which of the following are the principal causes of infant mortality in India? Acute respiratory infection, congenital anomalies, childhood cancers and diarrheal diseases. So infant mortality in India is mainly due to preventable and early life conditions. IMR in India is dominated by infections that include acute respiratory infection, diarrhea, low birth weight, and congenital anomalies. So out of these, the correct option is 1, 2 and 4. Childhood cancers are rare and not significant contributor of IMR in India. So the correct answer is 1, 2 and 4. Which of the following is the most common cause of mortality in infants between 1 and 12 months of age in India? So the correct answer is respiratory infections. Why? ARI, particularly pneumonia, is the leading cause of death in this age group. Diarrhea, it is common less than acute respiratory infection. Malaria is rare in infants, and prematurity affects neonatal, that is less than 28 days, not infants aged between 1 to 12. So the concept is that once the baby survives the neonatal period, infections like pneumonia become a major threat for the survival of the baby. Hence correct option is respiratory infections. In a town with 1 lakh population, there are total of 2500 live births in a year. There were 75 total deaths of children before the age of 1 month, total 200 deaths before the age of 1 year, and total 300 deaths before the age of 3 years. Which of the following statement regarding infant mortality rate of the town for the given year is correct? So first let us calculate infant mortality rate. Infant death under 1 year is 200 and the total live birth was 2500 multiplied by 1000, so it comes out to be 80. So the infant mortality rate is 80 per 1000 live birth. Now let us analyze the statement. The denominator is 1 lakh. It is a wrong statement. The denominator is live birth, not the population of the city or the town. The IMR of the town is higher than the current national average of IMR for India. Yes, it is correct. The current IMR of India is between 20 to 30, approximately 28. So this is correct statement. The numerator is number of children dying before the age of 1 month. It is incorrect. The numerator in infant mortality age includes death within 1 year, not 1 month. Fourth statement, the IMR of the town is 80 per 1000 live birth. Yes, it is also correct. So the correct answer is 2 and 4. With reference to the determinants of neonatal mortality, consider the following statement. Neonatal mortality is directly related to the birth weight of newborn. Yes, it is a correct statement. Lower the weight, higher the risk of neonatal death. Gestational age. Neonatal mortality is directly related to the gestational age at which birth takes place. Yes, premature babies have immature organs and more prone to that. So this is also correct. Neonatal mortality is closely related to the educational status of the mother. Yes, it is also correct, because the educational status of the mother strongly influences neonatal survival via health-seeking behavior like hygiene, breastfeeding, etc. Fourth, neonatal mortality is low if the mother age is between 15 to 16 years. This statement is incorrect. Why? Because teenage pregnancies carry higher risk of neonatal mortality and the ideal age is between 20 to 30 years. So the correct statements are 1, 2 and 3 only. Among the following, which one is the most important determinant of infant mortality? Birth weight, age of mother, order of birth and interval between births. So the correct answer is birth weight, because low birth weight, especially less than 2.5 kg, is the single strongest predictor of infant death, particularly neonatal mortality. Age of mother, teenage or elderly mothers have some risk but not as decisive as birth weight. Order of birth, high parity can be a risk but not as strong as low birth weight. And birth interval, so short interval increases the risk but again not as most important as birth weight. Okay, so why birth weight? Because birth weight reflects intrauterine growth, maternal nutrition and placental function, making it the best proxy for neonatal mortality or infant mortality. So the correct answer is A. The most important single determinant of infant mortality. It is the repeat of previous question, and the correct answer is birth weight, because low birth weight is the predictor of intrauterine growth, maternal nutrition and placental function. If the birth weight is less, the baby is at a higher risk of mortality. Hence the correct answer is birth weight. Other options are also significant but not as decisive as birth weight. Hence the correct option is birth weight. Infant mortality rate is expressed per, so the correct answer is per 1000 live birth. 1000 under 5 children is used for under 5 mortality rate, and per 1 lakh live birth is used for calculation of maternal mortality rate. Okay, so the correct answer is per 1000 live birth. The formula for IMR is the number of children dying before 1 year upon total number of live birth into 1000. Hence it is expressed as 1000 live birth, and B is the correct answer. The maternal and child health care indicator that gives a good indicator of the extent of pregnancy wastage as well as quality and quantity of health care available to mother and newborn is. So the correct option is perinatal mortality rate. Why? Because perinatal mortality is, what is perinatal period? So perinatal period is after 28 weeks of period of gestation and within 7 days of life. So it includes both the factor, that is intrauterine issue, that is antenatal care, intrauterine growth retardation, stillbirth, immediate postnatal care including asphyxia, sepsis, etc. So it is the indicator of quality and quantity of health care available to the mother and newborn. MMR measures maternal death, not perinatal death. Stillbirth captures only antenatal losses, and IMR, infant mortality rate, excludes stillbirths and focuses on full infancy. Hence, that is perinatal mortality rate, bridges maternal and neonatal care quality, making the most comprehensive for pregnancy outcome evaluation. So the correct option is D. Most common cause of maternal mortality in India is, so the correct option is obstetric hemorrhage. So leading cause of maternal death in India includes PPH, that is postpartum hemorrhage, APH, that includes placenta previa or abruption. Why other options are less common? Obstructed labor, it is nowadays reduced due to institutional delivery. Unsafe abortion contributes but less than hemorrhage, and toxemia of pregnancy still relevant but ranks below hemorrhage. In low median income countries like India, hemorrhage remains top killer due to anemia, delayed transport and poor access to obstetric care. The correct option is A. As per the latest definition of WHO, late maternal death is defined as death of a woman from direct or indirect obstetric causes after more than X days but less than 1 year after termination of pregnancy. Which among the following is correct value of X? Early maternal death is within 42 days and late maternal death occurs after 42 days but within 1 year. So the correct value of X is 42 days. Okay. Other options are just arbitrary numbers, and WHO describes late maternal death after 42 days but within 1 year. So correct option is C. Among the causes of maternal mortality, which of the following is correct in descending order of maternal deaths in India? So the leading cause of death is due to hemorrhage. Then after that it is sepsis due to poor asepsis or home deliveries. Then there is unsafe abortion, especially in rural areas or untrained setups. Obstructed labor is less common due to rise in institutional delivery. The correct option is D. Hemorrhage is the most preventable cause, but it can be fatal if not handled in time. Okay, so this is the correct descending order of causes of maternal mortality in India. Which of the following vitamin gives a supplement during the periconceptional period to a woman that can help prevent the neural tube defects in the baby? The correct option is folic acid. Folic acid supplementation during periconceptional period, usually given 3 months prior to conception, prevents neural tube defects like spina bifida or anencephaly. The mechanism by which folic acid works is that it causes DNA synthesis, leading to closure of neural tube in early embryogenesis that occurs during the 3rd to 4th week of gestation. Neural tube defects can be prevented by folic acid. Which one of the following statement is are correct regarding the essential obstetric care under the reproductive, maternal, newborn and child health care program. So under this program there is essential obstetric and newborn care. In this registration, antenatal care, safe delivery, postnatal care and newborn care is provided. Provision of first referral unit is under CMOC, that is comprehensive emergency obstetric and newborn care. So this is out. Provision of at least 4 postnatal checkup, this is also incorrect. So the correct option is 1 and 3. Which one of the following is not done as a screening test in pregnancy? So the correct option is serum cholesterol. VDRL is done for syphilis, diabetes is done to screen for gestational diabetes, and neural tube defect is done by a serum AFP or anomaly scan. Cholesterol is not routinely checked unless there is high risk, for example familiar hyperlipidemia, because pregnancy itself causes physiological hyperlipidemia. Okay, so this is the odd one out, and rest 3 tests are done routinely as a part of screening test in pregnancy. A village X has a population of 5,000 with a birth rate of 25 per 1000. In any given month, how many pregnancies should be registered with ANM of the village? The birth rate is 25 per 1000 and the population of the village is 5,000. Total number of birth that comes out is 125. There is 125 live birth. Okay. Now this is the first step. Now we need to calculate the total number of pregnancy. So in this we need to add 10% of total live birth. Why? Because this accounts for the pregnancy wastage. So 10% of 125 is 12.5 and it comes out to be 137.5. So let us take it as 138. Now the registration takes place at the 3rd month and the delivery takes place at the 9th month. A woman is registered for only 6 months. And if we visit at any given time of the year, so the total number of pregnancies that should be registered with the ANM is 69. Okay, hence the correct option is D, 69. A 25-year-old woman is a sedentary worker. She is a lactating mother with 3-month-old child. Which among the following is best approximation of her energy requirement in terms of kilocalories per day? So for a sedentary female, the energy required per day is about 1660 kilocalorie. She is lactating with a 3-month-old child. So for that she needs additional plus 550 kilocalorie. And if the children is between 6 to 12 months, then she needs extra of 670 calories. But the baby's age is 3 months, so she requires plus 550 calorie. And on adding it, we get approximately 2200 calorie. This option is correct. The amount of iron lost per 28-day cycle in a menstruating woman is. So it is a fact-based question. Approximately 30 to 40 ml blood is lost during each menstrual cycle, which corresponds to approximately 12.5 milligram of iron. Okay, this is the correct answer. Why it matters? Because dietary iron requirement in women is greater than men due to this loss. When should breastfeeding be initiated to an infant born via normal delivery? So the correct option is within 1 hour. So WHO and Ministry of Health and Family Welfare has guidelines set at less than 1 hour. 2 to 4 hour and after 4 hour are incorrect because it is delayed and associated with higher risk hypothermia or hypoglycemia. Hence the golden hour of breastfeeding is within 1 hour of birth. The correct answer is B. Manual vacuum aspiration that has been introduced in primary healthcare center help in reducing which of the following indices? So the correct option is maternal mortality. MVA is used for safe abortion and managing incomplete abortion. It prevents unsafe abortion, which is a major cause of maternal death. And introducing it into the PHC even reduces the death due to unsafe abortion. Hence the correct option is D. All these three are unrelated to abortion care. Hence the correct option is D. How many postnatal baby visits should be made by the ANM to the house of a low birth weight baby? Under the HbA1c guideline, low birth weight baby, ANM should make 6 postnatal visits at home in the first 42 days. The visit schedule is 3, 7, 14, 21, 28 and 42. So in case of institutional delivery, the ANM needs to make 3 visits, and in case of home delivery, the ANM needs to make 4 deliveries. The 3 deliveries are on 3, 7 and 42nd day, and in case of home delivery 1, 3, 7 and 42 days. Keep in mind this is done by ANM. The ASA visits are different, so don't mix it up. This one is being asked for ANM visit after the birth of baby. ASA makes separate visit. It will be discussed later on. So the correct option is 6 visits. Which one of the following statements regarding the growth chart is not true? It is used as a tool for growth monitoring and diagnostic. Yes, it is correct. It is used for planning and policy making. Yes, this is also correct. It is used as a tool for action against Anganwadi worker. This is incorrect. Why? Because growth chart are meant to monitor the child growth, not to take punishment or take action against the Anganwadi worker. If a child is not growing well, it is seen as a chance to intervene early, not to blame or penalize the worker. So it is the correct option. Option D, it is used as a tool for teaching and evaluation of effectiveness of the program. Yes, it is true. It helps families about child health and also measures how well the program like ICDS are working. So the correct option is C. Flattening of the growth curve in the growth chart signifies. It signifies that option C, the child is showing sign of growth failure. Why? Because normally in the growth chart, the growth keep moving upward as the child gains weight or height. If it is flat or it becomes straight, it means that the child is not growing properly. It is showing sign of early growth failure. Why other options are wrong? Child is on a healthy path. It is incorrect. A child's graph will steadily rise and not stay flat. Okay. Child is severely malnourished. It is incorrect. Wrong is the first diagnosis. Flattening usually means early failure and not severe malnutrition always. And D, child does not need special care. It is wrong. Flattening means it is showing the child is showing sign of growth failure and urgent attention is needed to prevent worsening. So correct option is C. For a child age 4 year, an Anganwadi worker detects that the weight is lower than expected. What should the Anganwadi worker do first regarding the malnutrition detected in the child? So option A, refer to nearby health center. It is incorrect. Not every underweight child needs immediate medical referral. Option B, refer the child to a nearby nutritional rehabilitation center. It is also incorrect because NRC is only for severe acute malnutrition. Start fortnightly deworming. So it is also incorrect. Deworming is important, not the first move without proper nutritional advice. Okay, so correct option is C. Why? Because the first step is education and counseling of the parents, because many cases can be managed by teaching how the mother to give child better nutrition and available foods. And if there is no improvement even after counseling, then we have to refer. Okay, so the correct answer is C, give nutritional counseling to the mother. Children of severe acute malnutrition discharged from NRC should be observed in the community by Anganwadi worker as per which of the following schedule? So after the discharge, close weekly monitoring for 1 month helps to catch any relapse early on. Okay, and after the first month, fortnightly visit, that is on every 14th day, are enough if the child is stable. So in this, the correct option is this. Anganwadi worker needs to visit the child once a week for the first month and then once fortnight. So this is the correct option. Which of the following is included in detecting a child with severe acute malnutrition? So to detect a child with severe acute malnutrition, these 3 criteria must be present. The first one is that bilateral pitting edema. Second one is weight for must be less than -3 standard deviation, and the mid upper arm circumference must be less than 11.5 centimeter. So according to this, option 2 and 3 is correct. Bilateral pitting edema, weight for height score is less than -3 standard deviation. Mid upper arm circumference is less than 12 centimeter. It is incorrect. It must be less than 11.5 centimeter for to be categorized into severe acute malnutrition. Weight for age score less than -3 standard deviation. See, weight for age tells us about that the child is underweight, and this may be a sign of onset of malnutrition on chronic protein energy malnutrition. So it is also incorrect. It is not a criteria for acute malnutrition, severe acute malnutrition. So correct answer is option 2 and 3. Among the following, the best indicator for acute malnutrition in the under 5 children is. So the correct answer is weight for height. Why? Because acute malnutrition is best captured by weight for height, because it shows how thin the child is for their height. That is, it indicates wasting. Okay. It responds quickly to short-term issues like infections or undernutrition. So this is the correct option. Why other options are wrong? Mid upper arm circumference is usually done for screening, but not a best indicator. Head or chest circumference is used for infants, routinely used in malnutrition assessment. And height for age shows chronic malnutrition, that is stunting, not acute malnutrition. So C is the correct answer. A rapid mass screening method that can be used by a medical worker for detecting malnutrition in preschool, that is age 1 to 5 years children, is. So the correct answer is mid upper arm circumference, that is measured by Shakir, and it is easy, it is quick, it needs just a tape, that can be done in field setting without the help of weight machine. Okay, and it helps in identifying children with acute malnutrition fast. So therefore it is a mass screening tool that can be used rapidly without the need of weighing machine, hence it is the correct option for detecting malnutrition. Which of the following anthropometrical measurements are carried out to assess the growth of child under 5 years of age? Weight measurement, yes, it is done to assess wasting, or if the child is underweight. It is measured to assess stunting, that can be a cause of chronic malnutrition. MUAC, yes, it is a screening tool which is used to assess wasting quickly and easily. So the correct option is 1, 2 and 3. A woman delivers a healthy baby with weight of 2.2 kg at the time of birth. What measures are to be taken? The baby should be exclusively breastfed for first 6 months. Yes, it is correct. The vaccination with OPV and BCG should be delayed till the baby is 2.5 kg of weight. It is incorrect. Vaccination should be done as soon as possible. It is not dependent upon the weight of the baby. The baby should be kept with mother and kangaroo care to be given. Yes, it is also correct. Skin to skin contact or kangaroo mother care helps with warmth, bonding and weight gain in small babies. Okay. But vaccinations OPV and BCG should not be delayed. Even if the baby is under 2.5 kg, they are given regardless of weight. So the correct option is 1 and 3. The cutoff standard for defining low birth weight babies in India is considered to be, so the normal birth weight is 2.8 kgs. If the baby is less than that, it is considered to be low birth weight baby, but the defining weight is 2.5 kg. If the baby is less than 2.5 kg, it is mentioned as low birth weight. If it is less than 1.5 kg, it is mentioned as very low birth weight baby, and if it is less than 1 kg, it is extremely low birth weight baby. Okay, correct option is C. Which of the following conditions can be screened during neonatal screening by biochemical test? So the correct answer is congenital hypothyroidism. Congenital hypothyroidism can be detected early by a simple blood test and detecting for TSH level. So early treatment prevents mental retardation. Congenital dislocation of hip is detected by physical examination by Ortolani or Barlow's test, not by biochemical test. Chromosomal abnormality needs karyotyping, not biochemical test. And congenital rubella is diagnosed by serology or clinical signs, not by biochemical screening. So the correct option is B. In a newborn, Apgar score has been recorded at 1 minute of birth. The doctor recorded the following observation: heart rate 92, respiratory effort slow irregular, muscle tone is flaccid, reflex response is no response, and the color of body is pink and extremities are blue. So what is the Apgar score on this scale of 1 to 10? Let's calculate the Apgar score. So the heart rate is less than 100, he will get 1 point. And the respiratory effort is slow and irregular, so it also get 1 point. Muscle tone is flaccid, so it gets 0 point. Reflex, there are no reflex, so it also gets 0 point. And the color of body is pink, but the extremities are blue, so it get 1 point. So the total Apgar score is 3. Hence the correct option is C. Value of 3 indicate there is severe depression and the baby needs immediate support. So that is why APGAR is calculated. The immunoglobulin that can be transported across placenta include. So it is a easy question. The answer is IgG only. Why? Because IgG is the only antibody that crosses the placenta and protects the baby till their own immunity develops. IgA does not cross. It is mainly found in breast milk. Okay. Hence the correct option is A. The term perinatal covers the period from. So the perinatal period is defined as the period from 28 weeks of gestation to 1 week after birth. Hence the correct option is A. It is important because perinatal care saves both mother and newborn. It is an important indicator. What is the correct daily dose of iron and folic acid to be prescribed to a child aged 12 years? So under the government guidelines, adolescent, that is 10 to 19 years, iron and folic acid have to be given weekly, and the dose is 60 milligram iron and 400 microgram of folic acid. So the correct option is C. Child starts speaking short sentences by the age of. See, this is a developmental milestone question. 2 years or 24 months, the child typically starts putting 2 to 3 words together like want milk or go park, like things like that. Okay. So it is the correct answer. At 12 months, single words are started. At 15 months, single words or gesture. So the correct answer is 24 months. You can also remember this as at 2 years, 2 words. A screening program for school children was undertaken with following results. 30% boys and 60% girls were found to be anemic. 50% children had history of passing worms in stool. 10% of children have poor vision and 5% of children have enlarged tonsil. In this context, which of the following is not an appropriate follow-up activity? Providing iron supplementation to all children? Yes, it is required to cover anemia. Administering mass deworming medication to all children? Yes, this is also a correct follow-up activity. Referring those children with enlarged tonsil for surgery? This is the incorrect option. Prescribing corrective spectacles to children with poor vision? This is also correct. Spectacles are necessary to correct poor vision. Why option C is incorrect? Because surgery is not the first line treatment option for tonsil enlargement. Many cases resolve spontaneously or just need monitoring. So surgery is, tonsils are managed conservatively and surgery is the last resort. Therefore the correct option is C. The following statements are correct for healthful school environment except. In the classroom, the desk should be of minus type. Yes, it is correct. Minus type desk means that the chairs can go slightly inside the desk. This prevents backaches and postural defect. Hence, minus type desks are recommended. Per capita space for each student should be 6 square feet. This is the incorrect option. The per capita space should be more than 10 square feet. Okay. Combined window and door area should be 25% of the floor space. Yes, it is also correct. One urinal should be provided for 60 students. Yes, it is also correct. One sanitary latrine should be provided for every 100 students. Recommended frequency of school health examination is once per 6 months. The correct option or the incorrect one is B. So with this, we have covered all 38 questions related to preventive pediatrics and obstetrics from UPSC CMS asked in 2009 till 2024. If you like this video, kindly share, subscribe and comment. And if you want to attempt the live quiz or want the PDF for this chapter, kindly visit our Telegram channel. Link is mentioned in the description. Thank you and meet you in the next video.